Good morning. On behalf of Bronxville residents, merchants, and neighbors, I want to welcome the county executive, the press, Bronxville Chamber President Leah Caro, Mary Marvin, and Claudio Icarino, who is the owner of Park Place Bagels 1 and 2. My name is Ruth Walter, and I'm the newly elected Westchester County legislator representing North Yonkers, East Yonkers, and the village of Bronxville. I'm also a small business owner here in Bronxville. For 10 years, my family and I have operated Dobbs & Bishop Fine Cheese on Pondfield Road. I know how hard we work and our fellow merchants work to follow safe practices and bring great products to our customers. The restaurants and stores in Bronxville and across District 15 and all of Westchester depend on workers, residents, and visitors to keep our doors open and our businesses profitable. Our county board recently passed earned sick leave so that workers can stay home when they are sick and not spread their colds and other germs to each other and to customers. Today we see how beneficial to all of us that law was that was passed and signed by this county executive, George Latimer. I'm so grateful to the county executive for coming to Claudio's Park Place Bagels 2 for breakfast this morning, and I want everyone to know that Bronxville is open for business. We take precautions to keep our workers and customers safe every day. We all have become more aware of the 3 most important ways to stop the transmission of any virus. Wash your hands often. Keep a social distance. Stay home if you feel unwell. And as we've heard elsewhere, if you're extremely sick and need hospital care, call ahead. That will help hospital personnel prepare for your arrival. There will be more cases. There will be schools and other places that close to disinfect. Eventually, we will have quick testing and a vaccine, but all this takes time and patience. Please reassure your children and your parents and yourselves that all levels of government and all political parties will work together as hard as we can to address this health crisis as we do every other new outbreak and every year of the flu and other contagious diseases. And now I'd like to turn it over to the county executive. Thank you.
Thank you. I'm happy to be here along with Deputy County Executive Ken Jenkins, some of the members of my executive team in Bronxville, because Bronxville is open for business. Now, I didn't need to read through a dossier to know that. I've been coming to this village to eat for many different times at Underhill Crossing, at Wild Ginger, the fairly new Bronxville diner. I don't even need my notes to know what fine restaurants there are. I've got the waistline. I'm an expert at going out to eat. But Mayor Marvin and her community has done everything that they can do to try to make people understand that it is safe to be here, it is safe to shop here, it is safe to eat here. The contagion that we're dealing with, we're trying to deal with between the different levels of government, but it does not affect the way you go about your business every day. And I think it's important to understand that what Bronxville has really responded to this properly. We've dealt with the issues at hand here. This community, cases in this community are minimal, and the restaurants and the businesses of this community are open for business. I know that Leah Caro, who heads the Chamber of Commerce, has the encyclopedic knowledge of every organization, every community that's here. But we want to be sure you know that we know that Bronxville is a great place to come to, it's a safe place to come to, and you should come to Bronxville.
Thank you. I love when you say come to Bronxville, County Exec.
I do say that in every community I'm in.
No, I just want to say that we've got a great partnership with the county, with the hospital. I'm someone who walks and shops, and I haven't changed my habits one iota. I am just careful and realistic, and I just say support our merchants. And in fact, when I left the office, my staff said, don't come back without bagels and cream cheese. So you're welcome here, and as I say, just follow me through town because I'm always up and down the streets. So thank you.
Good morning, everybody. I think I can speak for all of the business owners here in Bronxville when I say please do come patronize our stores, eat in our restaurants. Bronxville is 1 square mile. We have 34 different places to get something to eat or drink, which is quite a lot, and they're all ready to have you come in. Many of the shop owners are being conscientious and offering hand sanitizers at their desks, but really, the way you live your lives, as everyone here has said today, shouldn't change dramatically. But I'd rather see you shopping in our stores than buying online, and really I think probably that's a bigger danger these days. So again, welcome to Bronxville, and we're going to have a bagel.
Let's get a bagel.
I didn't eat breakfast yet.
Since you've all come to have bagels, you may have questions, so I guess we should open them up. If we can answer them at this point, we will. There are some things we're not going to know on the coronavirus until the governor has his press conference at noon, but the mayor and the county legislator and I are happy to answer any of your questions. Peter.
Have you had any feedback from businesses around Westchester? Are there examples of businesses being hurt, or is this an exaggerated fake news story?
You know, I think that as I've said before and others have said before, the fear of the virus has spread much faster than the virus itself. And that fear has caused some number of people to feel that they don't want to go out as they might normally to shop and to dine. So I do think there's been some loss of business by our business community. And one of the reasons why we're here today is to remind people that there isn't anything to fear and they should feel comfortable in coming out. Franklin Roosevelt used that phrase in a much more important setting, but I think it's important to understand that concern, that generic concern, is really misplaced. There's a specific virus that we have to deal with. There's specific steps we have to take to deal with it, but that does not stop people from coming out shopping and enjoying business. And if there has been a little a lag in the business community, that's why we're here to try to push that back up to normal levels.
And does the county have any advice for businesses at this point?
Well, I think what we're trying to do is dialogue with the business community. Shari Rosenasher, who is with us here, is our liaison to local chambers of commerce. We've tried to do certain things that we think would be helpful to the business community. I know there's things we could do that would be more important, but the bottom line is that it's not so much that we have advice to businesses. What we're trying to do is talk to the general public and indicate that these businesses welcome your shopping and welcome your involvement, and there is nothing to fear with that involvement. Other questions, Ty?
There was a case yesterday of the coronavirus at the health hospital. In which a woman in her 50s came in on Saturday. Do we know anything about that case?
I would say by this afternoon we'll have more details. As you know, I assume everybody knows in the media, the state is doing the testing, and they have the test results, and they announce the test results daily. The governor will announce the number of cases, and I don't know if he will do that, but we'll get statistics to follow that will identify those that are hospitalized. We're looking, obviously we have a lot of cases in Westchester County, but we're looking at the number of cases of people that are hospitalized, so we're certainly going to look at that and any of the other stories we've heard. We want to make sure that we are tracking people who may be hospitalized because of the coronavirus and not some other action. And, you know, there's always people going into Lawrence. By the way, Lawrence Hospital is still a fine medical care facility. It's open. It is helping people get well as we speak. But all of the hospitals of Westchester County and the tertiary care medical center are dealing with people who are coming in every day with some type of illness. We want to be sure that we can track whether they are related to the coronavirus. At this moment, as I'm standing here, my understanding is yesterday's statistics, 8 hospitalized individuals statewide, 1 from Westchester County, the index patient that we all talk about that began this, of the remaining 96 cases that were announced yesterday. I expect when the announcement comes out later today, the number of cases will rise because there's been testing in the cohort of people that were exposed. So I expect that number will rise, and Ty, I'd say by early mid-afternoon, we'll let you know if we have additional hospitalization numbers. Right now the number is 1. We'll see where we stand by this afternoon. We don't, you know, Peter, we don't have an exact number. There's two levels of quarantining. There's precautionary quarantine, voluntary quarantine, people who may have been exposed, and then there's mandatory quarantine, and that would be everybody who's tested positive. So the simple math would be if we have 1 person in the hospital, 97 cases, 96 people mandatory quarantine. The precautionary quarantine, we have estimated could be as many as 1,000 people, and not just from the one hotspot, but from other incidences around. And some of those have spun out a doctor at a White Plains medical practice, an individual who was in the courts in Cortland. So we don't have a solid number to attach to it, but I think it's a fair number to say that we're in the range of 1,000 people that are under voluntary quarantine. I'm sorry, Peter, I missed you. Yes. Yes, there's a procedure that's done to check on them. The primary check is done by phone, it's Skype, I don't know if that's Skype, but I mean some sort of visual identification of them in their homes by phone. And then obviously if we have any indication that somebody who's under mandatory quarantine is leaving the premises, then the state police have authority to use to require them to go back into their homes under mandatory quarantine. We have not had any incidences where that was necessary to my knowledge yet, and I think most people understand what's at stake here. If somebody is under mandatory quarantine and walks the dog and interacts with anybody while walking the dog, if they think they can just slip away and go to the hardware store, you know, they're opening the door to additional cases, which we all want to avoid. The people of Westchester are no doubt frustrated. I mean, we're all frustrated in government, but the people who are under quarantine, whether mandatory or precautionary, are no doubt frustrated. They have to suspend their lives for 14 days, maybe more depending on the circumstances. And if that happened to you or I, we couldn't function in the jobs that you and I have. So I understand the pressure and the frustration, and it probably grows as the days go along. But right now, that's what we're advised to do by medical professionals as the best way to try to limit the amount of contagion from expansion. So we're trying our best to enforce that in as realistic a way as possible. We've had good response as far as we can tell to this point. Well, to be honest with you, I don't think personally, it's George Latimer talking, I'm not a healthcare professional, I don't think the act of closing a school automatically improves the slowing of the contagion. Because what happens when you close a school? If a person is working, their children have to be watched by somebody, oftentimes by their grandparents. I'm more concerned about seniors being exposed to the virus than I am about any other demographic category. When you close the school, if there are children that are on nutrition programs, how do we know that they're going to get that nutritious meal during that period of time? And in parts of this county, that's a serious concern, and that's a different kind of health cert. When the school are closed, but the students aren't put under quarantine, because right now when you close the school district, you haven't said all those kids are quarantined, then they go out and play, and they interact with other kids. And the chances of spreading the contagion is actually greater than when they're in a controlled school situation. So I understand there's a lot of pressure. I think some of it comes from the CDC. Candidly, I think the great mistake was the failure at the federal level to get testing out there at a fast enough level, at a complete enough level. Because rather than closing a school, the logical thing to do is to test everybody in the school. And if you find out that Johnny has the virus, Johnny stays home. If Jimmy doesn't have the virus, Jimmy goes to school. And you deal with that cohort of young kids who have the virus rather than all of the kids with a mandatory closing. And if you do a mandatory closing, Bronxville's a bit of an exception, but in most districts, elementary schools are regionalized. In the bigger communities, the Yonkers of the world, the New Rochelle's of the world, 5-6 miles between elementary school A and elementary school B. Those kids aren't in normal contact. If you think there's a geographic element to the contagion around elementary school A, but you close the whole district, you're closing elementary school B 5 miles away. And that's not an uncommon thing. That applies in places like Harrison, in a number of other locations in the county. But I have to say that the healthcare professionals are making decisions, and I suspect they're making decisions, you've heard this phrase 100 times, with an abundance of caution. And an abundance of caution is a good thing. But I also think more important than an abundance of caution is a rational assessment of risk. And we do that all the time. Leah has in her organization businesses who, as a profession, assess risk. And they don't say, well, let's not take any risk and go to the extreme and let's not do anything. You can't shut the society down unless you have valid reasons to do that, which means a widespread contagion that is everywhere at all levels of demographics, and we are not at that point in Westchester County today. So we're arguing for rationality. Take the steps that are necessary. We had a conference call that Mary participated in yesterday where we talked about what are our programs for senior citizens and how do we want to try to reduce that, because that's the cohort. If the virus is exposed to seniors, there's a greater likelihood we'll have more severe illnesses. But the concern about school children, they are much less likely to contract the disease given their antibodies and the fact that as young in age, they're dealing with all kinds of coronaviruses. Keep in mind, this is novel coronavirus. It's a new coronavirus. There have been other coronaviruses out there, and many of the kids have been exposed to them just as kids growing up. When I was a kid, I ate dirt, I touched everything, and had no sense of personal hygiene at that age. And they overcome those diseases through the natural body antibodies. So all I'm looking for is balance and proportion in our response. But the CDC has every right to make their decisions, and at our level of government, and at Mary's level of government, at the town level of government, the school districts, we will do what a superior level of government tells us to do.
But again, the kid's parents, do you think the school closing increases your
I would say it depends, and I know that sounds like a typical Dodge answer. It depends on which school district and what are the circumstances. If you tell me that you have 4 cases in a particular elementary school, and one of the cases is a teacher that has a class of 22 kids, that's a much more compelling reason to close the school. If you tell me that you have no cases in the school district, but one kid in another class or in one class in another school played hockey with a kid who might have been exposed, that's a much lower level of reason to close the school. So the question is, what's the basis upon which you close it? Do you close it as a knee-jerk reaction, or have you done some analysis? And what I've argued, and I'm not the first person to say this, governors and others have said this, the testing has been woefully inadequate to judge whether or not the contagion is in a school before you close the school. You argue that you're going to close the school preemptively, but you haven't tested even a representative cohort to know whether the virus has spread in that school. Now, again, that's at the federal level, but they were slow out of the block getting test kits out. They have yet, maybe I can be corrected, they've yet to authorize automated testing, which I'm told many labs can do. Have they done that yet? They have not done that yet. That would allow you to do 1,000 tests a day rather than 100 tests a day. And those would be rational things to expect out of the federal government that would allow us to do our jobs as local officials. Now, I want to have some bagels, so, I want to. Okay, Peter?
The U.S. Surgeon General seems to indicate that the country as a whole is out of the containment phase and into the mitigation phase. Are you satisfied that the county can handle whatever may come along as numbers do go up? Some suggest numbers will double each week. And as county executive, are you still eating dirt?
No. I have to fend off a little bit of it, but I don't eat it anymore. The important thing is to say that we're doing everything we can rationally do to respond to the facts as we have them, and they do change day to day to day. Only a fool would say it's all under control, because how can you predict what's going to happen over the next few days and where the contagion may jump up? What I will say is we formed a working partnership with local governments. We're on constant contact with them. They're getting their concerns up to us. If we can resolve them, we do. If they belong within the state ballpark, we refer them up to the state. We had a conference call yesterday with all the municipal governments. We had a conference call this morning with representatives of school districts, which we met with yesterday morning, a large cohort of school districts. We're trying to figure out how we can coordinate both information on health decisions with education department policy, which is a state prerogative. So I guess, Peter, the only thing to say is what's realistic. We're responding in every way we can to the information on the ground. I'll give you one more example of it. We did not cancel any county events prior to this, through this weekend. On Monday morning yesterday, when we sat and we looked at where we were advancing to, we made the decision to postpone 5 events. Those 5 events are events where we have a cluster of people together. We did not stop the opening of our golf courses. That's coming this week, because when people play golf, they don't cluster in a large group of people. We did not shut down our nature centers, where people interact in the nature centers in small numbers of people, not in a concentrated area. On the other hand, where we had a couple of conferences this week of young people at the county center, we made the decision to postpone that to another date. And so that's the way you try to make decisions proportionate to what you think the potential risk is. And we shared some of that information with local officials, and the mayor Luisi of Tuckahoe and Supervisor Calavito and Mayor Spano, they have senior centers. They're making assessments now as to how they think those programs should or shouldn't go forward, and we're going to work with them cooperatively, whatever those decisions are. I'm going to take a break. We're going to have some bagels. I think the last time I offered you guys sushi when you were here, so I don't know if I can spring for bagels this morning. Have a cup. I'll buy you a cup of coffee. I can do that. Have a cup of coffee on me if you'd like.